So with any breast augmentation operation, it should be done under a general anesthetic, which is the way I would do all of my breast augmentations. That means there's an anesthetist present who helps to support the airway while you're asleep, and that usually means a breathing tube, and you shouldn't be awake for that at all. The procedure itself can be done in most facilities, day surgery, big hospital, whatever it might be. It shouldn't ever be done in an office setting, shouldn't ever be done somewhere where it just doesn't seem right. It should be done in a dedicated operative facility to maintain safety of airway, all the risks of anesthetic that can go along with that. While you're asleep, incision underneath the breast, create the pocket for the implants inserted, everything sutured up. And then after that, it's the recovery phase while you're there. Wake up in recovery, usually with pain relief and local anesthetic. While patients are asleep, I would typically put local anesthetic inside the pocket so that you're not in a lot of pain when you wake up. Most patients describe that sensation afterwards when they first wake up as a bit tight. Everything feels a bit tight or a bit full, but it shouldn't be no one should be in any pain. And then the subsequent few days after that is the recovery phase of getting on top of any pain that might happen, being on top of any swelling, and that usually involves cold packs, 1 or 2 cold packs for each breast, and then medications that we would normally send patients home with. So antibiotics are important, anti-inflammatory, analgesia, and then I would typically send most patients home with something called an antiemetic or an anti-nausea pill. And the reason I send patients home with that is that sometimes the reaction to the pain relief can cause a little bit of nausea, and it's nice to have them available immediately rather than having to phone to try and get them afterwards. And that's typically for the way it would work for the first few days after recovery. I would see all patients within the first week after breast augmentation, see them again at week 2, and then we start spreading it out week 4, and then out to week 12. During those first few visits, we want to make sure that everything is okay. So we've got all the pains under control, scars are looking okay, and there's no concerns with the bra, there's no concerns with anything along the way. The scar management that we would normally would start after week 4, and at that stage the scar is strong enough to start putting on a silicone gel or a silicone-based sheet that will help with the scar management and the scar underneath the breast. Anesthetic is an important concept to keep in mind. So anesthetic is something that either alters your consciousness or it alters the nerves and alters your nervous sensation to provide the ability to perform any procedure. So local anesthetic is an injected substance that dulls the nerves so that you don't feel pain. A sedation procedure is one where you're not fully asleep, your airway doesn't need to be supported, meaning you don't have to have an anesthetist who provides support for your breathing due to the medication that's given. And then there's a general anesthetic, which is one step further. That's where the medication that's given is of a level that you need support for breathing and to maintain your airway. One of the biggest controversies in recent history with some of the clinics around Australia is that they've been doing the procedure under local and sedation. So that's somewhere in the middle where the patients are sedated, not fully asleep, and then local anesthetic is injected to provide, to dull those nerves down and allows the procedure to happen. There's a lot of issues with providing local anesthetic procedures with a breast augmentation. Large volumes need to be used because it's a large area that is operated on, and as a result, the amount of local anesthetic that's given can become toxic. And what that means is with a lot of local anesthetic being injected, it can be absorbed into your body, and at some point that local anesthetic will cause disruptions to the heart's rhythm, it can cause disruptions to the brain, and patients can end up with seizures, heart attacks, and all kinds of awful things that can happen. So One of the issues of doing that under sedation is you tend to have to give large doses of local anesthetic to provide pain relief. Otherwise, you have to give a full general anesthetic and then use a modest amount of local anesthetic at the end to help provide a temporary pain relief afterwards.